and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency, and we're servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and today we have on the show Amelia Schreibman. I will say Dr. Amelia Schreibman because she is a doctor of nursing practice. She's also advanced practice registered nurse. Thank you for joining us on the show, Dr. Amy. And she can be reached at 561-302-5114. Her email is ami913@aol.com. And she's right here locally, Delray Medical Center at 5352 Linton Boulevard, right here in Delray Beach, Florida. Welcome to the show, Dr. Amy. What do they call you? Is it Dr. Amelia, Dr. Amy?
Amelia, but people who know me call me Amy. I answer to Amy.
What do you prefer?
For Amelia, actually.
Okay, Dr. Amelia. Wonderful. So welcome to the show. I'm so happy to have you on, and I really enjoy speaking to advanced practice registered nurses because I feel like, from my experience, you guys do it all. Like, yeah, you do it all.
I think it's an interesting thing because I think it's funny when you introduce yourself, Dr. Amelia Schreibman, they are quick to say, but you're a nurse, and like I tell them, do you call your therapist doctor? They have a PhD, and yes, so do I. So, actually, I have so it's a little confusing for patients, but we do practice exactly like a physician. The only thing we don't do is surgery. So we can order testing, we can interpret lab data, interpret radiographic studies, and do physicals and order medication, etc. So it's been a very nice career.
From my experience, I feel like you do more than doctors because you just
different approach because we learn differently,
right,
as far as what our focus is. And I think that when you have a nurse practitioner, we just don't look at the disease process. What's unique about a nurse practitioner, we look at the total picture. That includes the patient environment, support system, history of not only their medical issues, but their psychological issues, and any impediments to care and to becoming optimal in their wellness.
So, Dr. Amelia, can you share with our listeners and viewers just a little bit about your background, your experience, your education, and where you went to medical school?
Well, I didn't go to medical school.
And then where you went to school, schooling?
Well, I was born and raised in New York City. I went to the University of New York for my bachelor's degree. For my master's degree, practitioner degree, I went to Temple University. And for my doctorate degree, I went to Canyon University in Phoenix, Arizona. This is my 40th year. Believe it or not, and I have practiced. My role has been in critical care and cardiology. Now, so been a nurse educator at here in Florida, and I am at the medical center as a unit-based where I coach and train new nurses, but I also coach and enhance the practice of have been somewhat seasoned.
Wow, so you coach and train the new nurses.
Yeah.
I've heard from other nurse practitioners that, there's such a heavy load and they just have such, so much responsibility, and there's just a lot of, I don't know, it's just a lot. I don't want to
Very
say overwhelming. Thank you. That's the word. It's very overwhelming. What is it that you can do for them to help them maybe with that overwhelming situation?
I that I come across is that I don't want them to be fearful. I think it's important for them to questions. No question is dumb, and
Right.
that's the truth. And I think it's super important that they're still in training, they're still learning. So it's important to have an environment that is consistent with um, learning. So there's no fear factor. It's more of a coach situation. I think that that's what's important. You want to pure environment of learning, and I think that that's the key to any. Somebody feels safe with you as their teacher, they're able to learn a lot more. And the big things that you try to teach them, and the time management issues that nurses face.
And what is it that you can, through your years of experience, what is it that maybe you can teach them that would help them, I guess, ease the process of, you've been doing this for X amount of years. What kind of good coaching advice do you give them?
They just sit with them and say, you have to take 1 minute sometimes, and have to look at the room and decide, what is your priority. I think that that's really important. And patients on a medical service floor, you have to prioritize what needs to be done first. And I think that that's huge. The biggest thing I like for them to understand that these people are going to return to the community, and we want to get them not only to their optimal state of wellness, but we want to get them to be as independent as possible as well regarding their care. Because we really believe that when patients participate in their care, they do so much better because they take ownership.
That is so true. I love how you phrase that. When patients participate in their care, then it just makes it, I guess, a lot easier for everyone. Let me ask you, what is the age range of the patients that you treat, that you see?
Currently, it's 18 till end of life,
Oh, wow.
but usually outpatient 13 till end of life.
Yeah. What is, because you've
Why?
had, go ahead, I'm sorry.
No, I said wide range. There's definitely
Yeah.
a wide range.
I was going to say you do have a wide range. Is there any type of age or demographic or type of range that you prefer more than another? Is there any preference that you have? Is it with seniors or youngers?
No, I'll be honest with you. I enjoy my patients. I enjoy getting to know them. Each and every one is very, very unique. I think that's another thing, that we don't just treat the diagnosis, we treat the patient. And I think people forget that there's a patient and a human behind the diagnosis. You could have 10 people hospital with the same diagnosis, and they're 10 very different presentations, different needs, and different understanding levels. So I think it's important that as nurses we take that into account. It's just not everybody is a heart attack, not everybody is a congestive heart failure. Everybody is who they are, and then we go from that point.
I like that explanation. Thank you for that. What do you feel, from your years of experience, what do you feel helps a patient really heal themselves, or get a good diagnosis, or end up, going in the right direction faster than let's say another person? Are there any components?
Yeah, I think it's important that as a practitioner, we listen what our patients have, simply because when you listen, you hear different things, you hear nuances that are very important to the patient's care. And you learn what's very important to a patient. You have to take in the cultural aspect of someone. You have to take in their social mores, their social situation. These are all compounding factors that make or break a patient and how you treat them.
Wow, that makes sense. And what about patients that have the support from the family versus another patient who doesn't have that moral support from the family? Maybe their family is, in another state, or they're not, close by. How does that play into the role of them?
It's difficult when you have, particularly the elderly, we actually use the term orphans, because they're here and they're by themselves, and they're either their siblings or their children are not among them. And it's usually, we see that a lot with the elderly. So that's a difficult thing, and oftentimes they are not in a position to make decisions because they are not to do so. So we're very fortunate, very strong case management, large planning team at Delray who really help facilitate the best outcomes for these patients when they have to go back. So we don't go alone, which is nice.
I never heard that terminology before, and when you said it, it just hit me like a ton of bricks. Elder orphans. I mean, I've never heard it put like that, but now that you're saying that, it's strikingly, it's just struck me, and it's sad because, like you said, maybe their family has passed on or they're moved, to another state. But what do we do for the senior community that is in that situation?
As you must know, I have done many years in the home care as well as a concierge nurse practitioner. Home care is very intricate in how we send people back into the community, and other areas like skilled nursing facilities and you know uh, the living facilities. They're a very big part of what happens with the elderly, and particularly here in Boca Raton, we see a lot of seasonal people. This is
Yes.
season now. They're not only from the United States, but we also get a lot of people
Right.
from other countries, like Canada. So it's an interesting dynamic and sometimes perplexing. We've had a patient here that's from France in our hospital and has been there for quite some time now, because it's difficult to place her. I mean, what I think people don't understand, the compassion that goes into taking care of patients. No patient is turned away. Care is never given less if you don't have, economic stature, or you don't have insurance. Every single patient is treated with dignity and respect, and gets the highest quality of care that's available.
Yeah, I appreciate you saying that because, so many people have a fear of, maybe going to the doc or going in, ending up in a hospital for whatever story or reason they make up in their mind. But it's so reassuring to know that you being on the front line and you're coaching your nurse practitioners to really look at the patient as a patient, and like you said, not as a disease, not as the heart attack, not as the, whatever their diagnosis is. So it's just so refreshing, to hear that from you, because you really bring it down to the human level, which is really what we all need to
That,
hear. Yeah.
but that's what is people tend to forget. Not we're not to get you coffee, although we do that. We're not sure you got your tuna sandwich for lunch, although we do that as well. But we advocate for our patients, and we are their voice, and we're also the line of communication with a physician. So I think that people don't realize the intimate part of the nurse in the care realm. It's actually a crucial role in patients getting better and doing well, not in the hospital when they return to the community.
I love how you said that you advocate for them. That's just another feather in your cap, because it's like that's not, it just shows, like I said, you're advocating for their humanity, and it's not, something that you learn in a textbook. It's something that you learn, I would imagine, from doing the job and just having that desire to want to go into this industry. Dr. Amelia, we're going to take a real quick commercial break. We'll be right back. Alrighty. Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in. I'm with All County Healthcare, so we are a certified home healthcare agency. Please call us at 954-717-7027. We are in Palm Beach County, Broward, and Miami-Dade. Take that number down if you know anybody who needs our services. And we are with Dr. Amelia Schreibman, who is a doctor of nursing and adult nurse practitioner. She's right here at Delray Medical Center, 5352 Linton Boulevard, Delray Beach, Florida. You can reach her at 561-302-5114, and her email is ami913@aol.com. And I really just want to say really quickly about Delray Medical Center. I had a dear friend of mine who was admitted into Delray Medical Center. I would honestly say was the best care that I've ever seen, and unbelievable, bar none. So I'm so blessed that we have the services right here locally. So Dr. Amelia, thanks for coming back on.
My pleasure.
Yeah, I mean, you're really in such a great, I can't speak highly enough of where you're at. I mean, it's the number one, I think it's like the number one trauma center.
It's Trauma One Center here in South Florida, and we cover a great deal of services, not only trauma, but cardiac and cardiac thoracic surgery, vascular surgery. It's just a wonderful place to be a part of. They are a very solid and welcoming part of the community here.
Absolutely. World-class service, world-class people that work there, and we just appreciate everything that you do, and for all the professionals that work there. We really do appreciate that. So I think we were discussing a little bit about trying to remember what we were discussing.
We're
Yeah.
about how how nurses advocate for their patients,
Oh
and
yes.
I think people, the focus of becoming a nurse is not so much in the cure, but in the care. And it's very difficult to quantify how caring helps, but without the care of a nurse, patients don't do well.
So
That's
true.
just
It's so true. It's like you said, how do you quantify that? There's so much that you do and so many different, hats that you wear as far as like you saying you advocate for the patient. You really, find out about I mean just I know that as, a visitor, we run to you guys. We want to ask,
I think that people fail to realize too. We, as a nurse, we are the greeters, we are the calmer downers, we are the advocates, we are the hand holders, we are all those things. We kind of have to bring joy to a situation that is not always joyful.
yeah. Yeah. And you do it very gracefully, I will say that. I know
And I
that.
think people do. I think we do. It's a profession of giving and understanding the human condition. And I think that it's vital in healthcare, particularly during the pandemic. We
I
really,
was going to ask
we
you that. I was just going to ask you that, Dr. Amelia. What happened? So how did what were you doing during the pandemic? Were you hands-on?
I was actually not in the hospital setting at that time. I was doing out in the field. I was in home care at the time. A very different focus, but a difficult focus just the same. But I do have and colleagues who did work in the acute care environment. And in the beginning of the pandemic, it was devastation. Nobody knew how to.
Right.
So, got to take your hat off to the nurses because they were the ones there holding people's hands and contacting family and, gracefully um, helping people die with dignity.
Yeah, that was just terrible. And it was just so amazing to see throughout the world. There were the nurses and the nurse practitioners. They were just doing it all. And, hats off to all of you who do that, because that was a total another level, not knowing what was going on and, how contagious it was. And every day you guys were out there doing your job, and, really do appreciate all that you do, as a, as a whole. So, Dr. Amelia, we have 2 minutes left. If you wanted to share with us last minute advice for anybody as a patient, or whatever you'd like to share on how, we can help heal a little bit better. I think we might have lost her for a minute. Oh, there you are. So we have 2 minutes left, Dr. Amelia. Can you share with us any kind of
Briefly,
yeah.
that being a nurse is one of the most gratifying things, and it's probably one of the best um, on the planet. We have been historically number one in the most trusted profession across the board. The only time that changed was in when 9/11 happened. The first response before we were number two, but for the last 30 years, we've been the number one trusted profession. So I think that's an important thing to know, that we're all in to do better. No.
Yes. Thank you so much for your time. We have to wrap it up. We really appreciate you and all that you do. And you can reach her, Dr.
Thanks.
Amelia Schreibman, 561-302-5114. Thank you, everybody, for tuning in, and we will see you next week for another episode of You and Your Doctor. Take care and have a happy new year to everybody.